Hello everyone, it's lovely to see all of you here on a beautiful Sunday morning, and I'll wait for a bit till some of our viewers join in. Thank you all for taking the time to join us today. We have with us our doctors, we have our well-wishers, we have some patients of homeopathy also who have joined us, so it's beautiful, and we're going to have a lovely discussion. So I shall just wait for a bit so that everyone joins in. Hello Dr. Faiza, hello Dr. Shruti, nice to have you all online. Great. Love to see the enthusiasm this Sunday morning. Superb. Okay, so I shall begin now. Hello and welcome to Dr. Sankaran's online homeopathic clinic. And I want to thank all of you who are joining here today, and I'm sure more are going to join in. And for our very first Instagram live Q&A session. And in the latter part of this webinar, we can have your questions also for Dr. Sonali, who's going to join us in a bit, and of course for Dr. Rajan Sankaran, who's going to join us also in a little while. Yes, so thank you everyone for joining in. All right, so what is Dr. Sankaran's online homeopathy clinic? It is a unique portal which provides online homeopathic treatment at the click of a button. And especially today, during the time of the pandemic, it has become so important to have world-class homeopathic treatment from the comfort of your homes. And Dr. Sankaran's online portal does exactly that. The website is equipped to take your appointments and to connect you with 4 amazing doctors who are so skilled in their fields. And it provides world-class classical homeopathy approach to ensure a deeper sense of health and well-being. And what we do here is we address all kinds of cases, chronic cases, acute cases, and the doctors are very skilled because they have been trained by Dr. Rajan Sankaran himself, and they have been handpicked by him to come on this portal and to provide world-class treatment wherever you are in the world. And they have adopted his work ethics, which is so important, and are continuously involved in research and developmental activities. So wherever you are in the world, the best homeopathic treatment is now available to everyone. Today more than ever, holistic healing is the mantra. What is holistic healing? Well, it actually means that we do not address only the disease or try to cure only the symptom. Here we try to address the individual as a whole, and that is very important. And the online portal provides you exactly that, world-class treatment in homeopathy for yourself as a whole, in holistically, to heal yourself. So that is so wonderful. And so without taking a lot of your time, let me now introduce to you Dr. Sonali Bhonsle, who is going to come online right now. So before we start with Dr. Sonali Bhonsle's talk, hello, Dr. Sonali.
Hi, Shukrita.
Hello, hello.
It's so nice to see you on Sunday morning and, your nice way of introduction of homeopathy. I'm so
Yes.
pleased to listen to that.
Thank you, Dr. Sonali. But I want to tell our lovely audience here a little bit more about you. I want to introduce Dr. Sonali Bhonsle, who is one of the 4 doctors on this online portal. And she is going to talk specially on her area of bone and joint disorders. Dr. Sonali brings with her over 20 years of experience in homeopathic practice. She is currently working with Prana Homeopathy Yoga Center Pune as a consultant homeopath. And in the past, she was also the assistant professor at Bharati Vidyapeeth Homeopathic Medical College in Pune. And Dr. Sonali considers Dr. Rajan Sankaran to be her mentor. And she gets her inspiration from him for doing her best in everything. And she has in fact assisted him with COVID research project as a treating physician for hospitalized cases. This is very commendable, Dr. Sonali. You- Thank you
Thank you.
so much.
Thank you, Shukrita. Thank
Yes,
you so much.
you're a COVID warrior for us. Yes, thank you so much. And she also attributes her success to Dr. Shankaran's unique method of case taking, which has helped her solve difficult cases with ease. So, this is a very, very important thing. And thank you, Dr. Sonali. Thank you so much for everything. And we welcome you on this portal. And I shall now request you to please talk a little bit more about spine and bone disorders.
Thank you, Shukrita, for such a nice introduction and your way of telling my introduction. And it is my pleasure to be here on the portal right on 5th September, which is a Teacher's Day. And I feel, what all I can do good to my patient, to what all I learned from my guru. And I thank Dr. Rajan to be a great mentor, and if we are able to get good gurus in our lives, definitely it is a transforming experience for us, and we can move ahead in journey of healing.
Yes,
And that is how I have taken it for myself.
yes,
So,
yes,
coming to my specialty of bone and joint disorder, basically, when I was after my internship, I joined orthopedic hospital because orthopedics was considered to be a limitation to homeopathy. When you have a fracture, you have to go and set the fracture, and I felt I should know first limitations of homeopathy, so that I can explore the scope of it. And this is how my connection with orthopedics and joint and spine care started right in the beginning years of my clinical orientation. And I found a lot of scope and how much teamwork is needed in healing patients with spine and joint care.
yes. Very interesting to know, Dr. Sonali. That's true.
Yeah.
That's true. So, Dr. Sonali, yes. Can you tell us a little bit about what are these joint pains that we all get? I mean, now and more among the younger generation as well. What is this joint pain? What is this exactly? Pause.
Yeah, yeah. Actually, I will say joint pain. The pain is a signal,
Mhm.
it is a signal because it is protection mechanism of our body. When we get pain, we protect ourselves. So pain is a signal that pay attention, something like that. But pain in the joints, when it becomes chronic, it is it's foggy. It affects our psyche, it affects our whole rhythm in starting our day. Imagine starting our day with the pains and aches. It is,
Yes,
it takes away the enthusiasm, it takes away the juice of life. And
absolutely.
here we need to work on, so pain is a signal which says, come on, now take care of yourself. Now pay attention to what is happening to you in your life. what is this? Get it diagnosed. Get it some work on yourself. I feel like that. When I see my patients, I tell them, oh, you are not dead. That's why you are having pain. Because they keep telling me, that pain doesn't go. So I tell them it's good that you are alive and that's why you should have pain. Let's work on it together.
How nice. How nice. So that's such a lovely approach. That's true. That we have the scope in homeopathy to work on even these very grave issues of these extreme pains that happen. Yes.
Yeah. Pain like gouty arthritis. When we say arthritis is inflammation of any joint, and there are more than 200 types of bone and joint diseases. And gout pain are quite excruciating. I mean,
Yes.
and how to deal with it with homeopathic remedy. What is the onset? How is the progress? What is increasing the pain? How is the patient can be made comfortable? What is his whole posture? What is the change in posture and the pain? And these are the insights taken in homeopathy, and it's very important for homeopathic physician to know their patients very well with pain, in pain,
Yes.
and then we can see how we can help them.
Yes. Yes. So, what do you think are the factors that influence these sort of pains? What causes it? I mean, what are the reasons why these pains occur?
See, uh, anything to happen to us, no, we have something has derailed. It might be in life, some incident which has caused a lot of influence on a person, or it is simple loss, not doing things which we used to do. Like somebody good into exercise, but now skipping on the exercise because of too much, the career needs, or somehow not finding space for ourselves, or not having a right, choosing a right diet with awareness, not going for exercise which you like to do. And
Yes.
gradually there comes a maladaptation to
Mhm.
the life phenomena. And this maladaptation in every, we all have our some weak link. So in spine and joint care patients, which can have influence of family history, generally
Right.
one of the joints start aching, or they can have severe pain in the neck or battle. And again, it gets unrecognized. Patients generally try to pull over things. Okay, it is like this, it is like, and they take time, they do not go to the doctors and proper time, especially in India, and it can increase. This further maladaptation increases, and these are the reasons: lack of exercise, not having good diet, and maladaptive postures. Continuing and struggling with life circumstances on our own self without taking help. These
Yes.
are the factors.
Yes, yes, absolutely. These lifestyle factors. And could you talk a little bit about diet as well as a contributing factor to this?
Yeah. First diet is, I will say, the sunlight. How many
Okay.
of us are going in the sun and taking the sunlight?
Yes.
First is the natural resources.
Yes.
Second, that is water. How many of us are having water and drinking it with that relishness? You
Yes.
know, Third, very important is simple home cooked traditional food. How many of us are having simple home cooked traditional food regularly in a week? In
Right.
a week it might come, the ratio has come different way because of fast food and what are readily available, the food that easily dissolve on our tongue. Those are not the foods that will nourish our bodies and our joints and muscles. We need
Right.
something to crunch on. We need something like the lentils, the sprouts, the fibrous food and fruits, the colorful fruits, the garlic, the ginger, the turmeric, the till.
Yes.
These
Yes.
are our, we should choose these things with awareness. Yeah.
Yes. Yes. So would you say also foods that reduce inflammation is going to help
Yeah,
in these
very
cases?
much. With homeopathy, after giving the remedy, it's very important that foods that reduce inflammation, especially garlic,
Okay.
uh, turmeric, ginger,
Yes.
you know,
Yes.
food rich in vitamin C, amla,
Yes.
or
Yes.
sweet and sour fruit, like sweet
Okay.
lime, not the fruit juice, mind well, because there is added sugar. So
Right.
sugar and white things are not so good. So anything which we are chewing on well, rich
Yes.
in vitamin C, fiber, and
Yes.
colorful. This
Yes.
adds to our, yeah.
Yes. Yes. So can you also tell us, a little bit about the scope of homeopathy in treating these problems? Why choose homeopathy for this?
Yeah. It's a very nice question because homeopathy is the holistic science. So it's not only the physical phenomena is considered about the onset, about how the disease progressed, about what are the influencing factors, but also what are the changes in the personality since the disease has started or the beginning. So when we find a solution which can cover whole pattern of the patient which is disturbed,
Yes.
as I told you, the maladaptation. When that
Yes.
maladaptation has to be addressed along with the physical symptoms, we find that this is there in homeopathic science, and that's why I love this science. It's not only because I am a homeopath, but I go with each patient into their journey of illness, and when we reach the core and find a remedy and the effects of it in few months, they are very exhilarating. So I
Yes.
feel this is a good choice
Yes. Yes.
for
Yes.
treatment, for healing.
Thank you. Because we had a question from one of our viewers saying, what is the role of homeopathy in RA, especially?
Rheumatoid arthritis.
Yes.
Yeah,
Yes.
rheumatoid arthritis is the inflammation in the synovial membrane of the joint, and it causes lot of inflammatory material there. And the role of homeopathy is very broad here because we have to see again here what is the stage of rheumatoid arthritis. It is
Okay.
the in a primary stage, or it is in a stage where it is in the last stage where there is no more inflammation but there are deformities. In
Mm-hmm.
the last stage, we have to deal with the deformities by giving the homeopathic remedy and some splints like a stick to a person or a walker to help them. But in initial stages, it can be halted. It
Okay.
can be halted with a right homeopathic remedy. And
Okay.
the patient needs to be followed up very closely,
Okay.
especially for the pain episodes. And there is need of very positive counseling along
Right.
with the medicine. So it is not only giving the medicine, how are we helping our patient to move on? It's very important.
Absolutely. It sounds very, very positive and good because we just don't want to take the pills to get symptomatic relief, but we want to overall feel better, like a whole
Yeah,
lifestyle change that
yeah,
will help us improve our state. Yes, thank you
yes,
so much for clarifying that, Dr. Sonali. But
yeah.
and I would like to tell our audience here at this point, if you all have any questions, please type it in the chat box.